Hey guys, it's your private nurse here. Welcome back to the channel and welcome to today's video. So we'll be performing oral hygiene, and for the requirement we'll need a large tray containing a glass of water for dentures. We will need 3 galley pots containing the required amount of solution, and our cleaning solution or lotion will be glycotymolene, glycerin borers, and sodium bicarbonate. So guys, these are the 3 lotion we'll be using, and if you are not using this, just make sure to go in, pour the solution in required amount into the galley pot. And yes, so guys, I will be interchanging words with lotion and solution. So when I say solution or I say lotion, just know it's the fluid or it's the liquid we are using to clean the patient's mouth. So we will also need a receiver or a kidney dish with a large artery forceps, a dissecting forceps. We will also need a mouth gag. This is a mouth gag to help us open patient's mouth if patient is unconscious. And also we'll be needing a tongue depressor to help us depress the tongue. Please take note that oral hygiene is a clean procedure. So we will also need a bowl containing gauze swab, but we do not have gauze swab, so we are using cotton wools. So we will also need a dressing marking torch. It may be a shoulder cape. The dressing marking torch can be a shoulder cape, just like this. And we also need a dressing towel. A dressing towel so that we will not soil the patient's clothes or the bed linen. So guys, we will also need a kidney dish for used swab. So guys, before we proceed, I will want you to do this for me. Take 3 seconds to subscribe if you have not, like the video, and just share the video at the end when you are done watching the video. It really goes a long way for me and for the channel. Thank you so much. I really appreciate. So guys, the first thing to do is to explain procedure to the patient, tell patient why you are doing it, and we are doing this to keep the mouth clean, to make patients feel more comfortable, to improve patient appetite, and to prevent the lips from cracking, and to also keep dry mouth moist. Okay, so this is the purpose. So you are going to explain it and make sure patients understand if patient is conscious. But if patient is not conscious, you explain procedure to patient relatives. So after doing that, you are going to take equipment to patient's bedside, where patient the shoulder cape marking torch, and also you place your draw sheet and position patient in a comfortable position that will enable you to carry on with your procedure. Check for any denture in patient's mouth, and if there is any denture, put it inside the water to just keep it safe. Then make sure to screen the bed. Normally, because of video sake, we will not screen the bed. So the next thing to do is to you take a swab or a cotton wool, you soak it in sodium bicarbonate. So when you soak, you use your dissecting forceps to drain the excess lotion out. Then you clean patient's gum, clean the teeth, and then you clean the palate. And when the gauze is dirty, you discard it with the pair of dissecting forceps. Oral hygiene is indicated for people who have cancrum oris, who have halitosis, who has stomatitis. It's also indicated for very ill patients and unconscious patients who cannot clean their mouths by themselves. So guys, we are going to take another swab and then we will soak it in glycotymolene next. Drain the excess fluid and then make sure the whole mouth is covered this time. Clean the whole mouth. We are going to use the spatula to control the tongue if necessary. So guys, here are 6 scientific principles. 1. The use of sodium bicarbonate will help to loosen sores and debris from the teeth and oral cavity for easy cleaning. 2. Cleaning with glycotymolene will help to expose the taste bud, which in turn removes debris and improve appetite. Thirdly, cleaning also will help to reduce colony of microorganisms in the oral cavity to prevent infection. The solutions used will help to maintain the secretion of saliva, which in turn will keep the mouth moist and prevent cracking. Glycerin, borax will help to keep the mouth and the lips moist to prevent drying and cracking of the lips. So the last one, which is the 6th one, cleaning will also prevent halitosis, thereby boosting patient self-confidence and comfort. So guys, these are the 6 principles of oral hygiene. So guys, lastly, we are going to soak our swab in glycerin, borax, then we will clean the mouth and also make sure to clean the lips. So the glycerin will make the lip not to become dry or crack, and it will encourage the flow of saliva. If patient is unconscious, we can use this mouth gag. You just close it, put it in patient's mouth from the side, then you open it. If you're dealing with an unconscious patient, you have to use this mouth gag and tongue depressor. So guys, after the procedure, make sure to leave patient comfortable and a glass of water may be offered to the patient. Please note that if patient is able to clean their mouth by themselves, they should use own toothbrush and toothpaste. They should be given water to rinse the mouth and also a receiver to pour in return fluid. So guys, just make your patient comfortable, remove marking thoughts and the draw sheet. Keep patient comfortable, record that you've done your oral hygiene and everything that should be recorded. So guys, thank you so much for watching. See you all in my next video. Make sure to go down to the channel and watch other procedure video. Take your equipment back. Make sure to like and subscribe.